Hey everyone, and welcome back to another explainer. Today we're unpacking a topic that honestly is pretty alarming at first glance, but also incredibly hopeful by the end. We're going to explore the realities of bone cancer, pulling directly from the clinical insights of orthopedic surgeon Dr. Shuhei Ugaji. We'll be looking at the whole picture, from those subtle early warning signs all the way to the remarkable advancements we're seeing in modern treatments right now. So get ready, because the information we are covering today is truly empowering. Okay, let's dive into this, because this exact question is exactly how Dr. Ugaji hooks his patients. If you're sitting there thinking, wait a minute, cancer can actually form in my bones, you are absolutely not alone. It's a huge surprise for a lot of people. But it's a very real medical condition, and it's one that really requires our attention and understanding. So here's our roadmap for today. We're following the complete patient journey, starting with what bone cancer actually is, checking out the initial symptoms, walking through the diagnostic tests, outlining the three main treatments, and finally getting into life expectancy and rehabilitation. Section 1. What is bone cancer? Primary versus secondary. Right, so before we get too deep, we need to define our terms. When doctors talk about bone cancer, they're generally referring to bone tumors, and it's absolutely crucial to separate these from soft tissue tumors. Soft tissue tumors develop in places like your skin or your muscle, but a bone tumor, that originates or sets up camp deep within the hard structure of the bone itself. For today's explainer, we are focusing entirely on the bone. And this brilliantly illustrates the two main categories we really need to understand: primary and secondary tumors. Primary tumors originate directly in the bone. They're actually very rare, and surprisingly enough, they tend to strike children and teenagers way more often than adults. On the flip side, we have secondary or metastatic tumors. These are much, much more common. They start in other organs, like the breast, the lungs, prostate, or kidneys, and then they spread to the bones. And these predominantly affect adults. Moving on to Section 2, Initial Symptoms, Warning Signs to Watch. Okay, this is probably the most urgent part of our whole explainer today. The biggest red flag is right at the top: night pain. And we're not just talking about aches and pains, but pain that continues even when you're resting or dead asleep in bed. Think about it like this. A normal sports injury usually hurts when you move it, right? But pain that just won't quit while you're perfectly still, that is a massive warning sign. Other symptoms to look out for include visible swelling or feeling hard lumps directly on the bone. And terrifyingly, as a tumor grows, it literally eats away at the healthy bone tissue, making it super weak. This can lead to what doctors call pathological fractures, which basically means a bone can just snap from simple, everyday movements. Crazy, right? We also really need to talk about spinal metastasis. That's when the cancer spreads to the spine. The red flags here are severe back pain, numbness down your arms or legs, muscle weakness, and in the worst cases, an inability to walk at all. Look, if you or someone you love experiences these symptoms, this is absolutely not a let's wait and see situation. This means getting urgent, immediate medical care. Section 3. Diagnostic tests. Finding the hidden tumor. So how do doctors actually hunt these things down? They don't just guess. They follow a really strict step-by-step diagnostic funnel. Step 1 is usually an X-ray, and they're looking for abnormal translucency. Basically, they're hunting for dark spots where the bone has been hollowed out, or any swelling around the bone. Step 2 brings in the heavy hitters, CT and MRI scans. CTs are amazing for getting high-detail images of the hard bone, while MRIs reveal exactly what's going on in the surrounding soft tissue and muscles. Step 3, if they suspect a tumor, is a PET scan. This is a specialized whole-body scan to see if the cancer has spread anywhere else. And finally, Step 4 is the biopsy. This is where doctors take a tiny physical sample of the tissue to examine under a microscope. It's the only way to get 100% confirmation of the exact type and severity of the cancer. Section 4. The three main treatments. Fighting bone cancer. While a diagnosis is undeniably scary, modern medicine has a seriously robust toolkit ready for the battle. First up is surgery, and the goal here is complete removal. Dr. Ugaji points out that these surgeries are incredibly intense and dynamic. We're talking about operations that can take an entire day. Sometimes they have to put in artificial joints, use bone grafts, or even take skin and tissue from the patient's back to cover exposed areas, which is a process known as a skin flap. And yes, in the most extreme cases where the cancer just can't be safely removed, amputation might be the only option. The second tool is radiation. They use high-energy beams to kill off any rogue cells left after surgery or to shrink tumors down just to relieve severe pain. Finally, we have chemotherapy. These are powerful anti-cancer drugs that work systemically, meaning they suppress the cancer's growth throughout the entire body, and they're very often combined with surgery. It is a grueling process, but highly effective. Section 5. Life expectancy, survival rates. Now, what's really interesting about this slide is how it shows the drastic shift in the survival narrative. For osteosarcoma, which is a type of primary bone cancer, the 5-year survival rate in the past was a pretty grim 30%. But today, thanks to massive, game-changing leaps in treatment, that survival rate has skyrocketed up to between 60% and 80%. I mean, that is huge. Survival is now the expectation for a lot of people. For secondary or metastatic tumors, the outlook really depends on how early the original cancer was caught and how well it's being managed overall. Of course, surviving the cancer is literally just part of the journey. The physical work to regain movement is just as crucial. After those massive surgeries involving artificial joints or tissue grafts, the body basically has to relearn how to move. Patients work incredibly hard with physical and occupational therapists to build back muscle strength, flexibility, and balance. Because the ultimate goal isn't just surviving, it's a smooth, confident return to your normal daily life.
And that brings us to Section 6, Hope and Rehabilitation. Empower yourself.
So what does this all mean for us? Well, while primary bone cancer is rare, your absolute best defense is general wellness. Your preventative power really lies in regular health checkups, because catching things early is literally everything. On top of that, Dr. Ugaji strongly advises against smoking. Smoking heavily damages your entire body's systemic health and severely ruins its ability to heal itself. Protecting your overall health is your strongest armor here. I want to highlight this direct quote from Dr. Ugaji because it really provides the emotional climax for everything we've talked about today. He says, with proper treatment, patients can recover and they can run around energetically again. It's just so encouraging. Even after those huge, life-altering surgeries, human resilience combined with modern medicine allows people to reclaim their joy and get moving again. We've covered the science, the symptoms, and the undeniable hope waiting on the other side of treatment. So I want to leave you with one provocative thought to mull over. Are you listening closely to what your bones are telling you? Seriously, don't ignore that persistent night pain. Don't just brush off that weird smelling. Your body's incredibly smart, and paying attention to it could make all the difference in the world. Thank you so much for joining me on this explainer. Stay healthy, stay curious, and I'll catch you in the next one.